The Evidence2Practice Ontario program is supporting the delivery of care across the province by making it easier for clinicians to access and apply best practice information and quality standards at the point of care. E2P is led by the Centre for Effective Practice, eHealth Centre of Excellence, and North York General Hospital, and is funded by Ontario Health. The Anxiety Disorders and Depression tool has been designed to support clinicians in the early identification, comprehensive assessment, and timely diagnostic clarifications using digitally embedded validated tools for anxiety disorders and depression in adults ages 18 and older. Modules based on the core clinical functions of the quality standards have been developed to support clinicians in the assessment, diagnosis, treatment, and/or management of patients. These modules are scalable to multiple conditions, and E2P will be providing similar tools for heart failure, COPD, and diabetes. Mental health care is more important than ever, yet there are many challenges for clinicians to provide standardized care for their patients. We understand that keeping up to date with best practice guidelines, diagnosing and treating complex mental health conditions, combined with the lack of patient care plans and resources for self management supports, is a pain that causes extra administrative burden that can contribute to clinician burnout. With flexibility in the integrated GAT7 and PHQ-9 forms, clinicians have the options that allow the screeners to be completed directly in the tool, or patients can take them home and either email the score or bring them back at a later visit. By using the E2P tool, clinicians can access standardized treatment plans, track patient progress, and prescribe medications all in one place. By giving clinicians improved access to best practices, evidence-based standardized information, clinicians and patients can feel confident when putting together a care plan. E2P also provides clinicians with real-time data on patient outcomes, allowing them to adjust treatment plans as needed for better results. It is important to mention the installation and setup process for this tool in Accuro. Please allocate 30 to 60 minutes for this installation process, and note that it is crucial that all lab results are added and correctly mapped to optimized functionality. In this video, we will walk through two patient scenarios to showcase the expected workflows the tool was designed to support. Patient 1 is newly diagnosed and the tool has not been used with the patient previously. To get started with the tool, the first thing we see is the assessment module. We have designed the tool to be used as a screening tool for patients who struggle with their mental health. Here we've considered different workflows clinicians can take when inputting GAT7 and PHQ-9 scores, and we've embedded the ability to enter the scores directly in the tool, as well as completing the questionnaires with the patient during the visit. In this module, you are able to document the information related to the patient's mental and physical examinations, suicide risk assessment, previous history, lifestyle, and etc., all while having the ability to review relevant lab values. You might also be interested in sharing some resources with the patient. In the Patient Resources module, you'll find handouts the patient might find useful in learning more about mental health. Otherwise, for a newly diagnosed patient, this is potentially where you may end the visit. Our second patient scenario is a patient who has been diagnosed with anxiety and depression for 5 years. This is what the patient's chart may look like once the tool has been used over time. Here you are able to pull in the previous information that was documented for the patient. You have the option to update any new changes or clear the information and start fresh. We may be interested in reviewing the medication module. Here we have the ability to review the current list of medications, document if the patient has been taking them as directed, record any side effects, as well as make changes to the medication plan. We have embedded many tooltips and links for the clinician to support in clinical decision making. Once the medication plan has been updated, we may want to discuss therapy options. We've included talking tips throughout the tool to support clinicians with patient conversations. Navigating to the management module, we have clearly outlined first-line therapy options related to psychotherapy, lifestyle considerations, and natural health products to make decision-making more efficient. Regardless, we've designed the tool to be flexible to fit any workflow. The E2P Heart Failure EMR Toolkit is equipped with an easy-to-use installation guide, and our dedicated team of change management specialists are also available to provide tailored implementation support, including EMR setup, installation, and training for your staff at no cost. In addition, our partners at the Center for Effective Practice can offer supplementary one-on-one discussions with an academic detailer on balanced, evidence-based information on heart failure. With E2P, clinicians can provide enhanced mental health care for their patients, all while reducing their own workload and stress. Try our anxiety disorders and depression tool today, and remember our team is here to help.